Everybody, happy Friday from New York. It's Dr. Linda, President and founder of the Vascular Birthmarks Foundation, along with the VBF, Director of Business Operations, Kristin Delgado. Say hi to everybody.
Hi, everyone.
And today we are here for one important reason, for you to find out what we can do for you. So we are live. It says we're live. I need to know if you're there. Anybody who's there, start sending up your little hearts and your little notices so that we know you can see us, because this is always a check, because we're already, we have 3 people, it says, that are on. So those of you who are on, hey, Aaron, hi. Joey, hi. April, hey, hi. Just send us a little thumbs up. Thank you, April. So it's very important that we find out what VBF can do for you. We have so many things going on, Aaron and Joey. Corinne's on. We have our conference that we have every year. We're the only charity in the world that gives you free lodging for vascular birthmarks, free conference admission, clinic appointments, some limited number, but we have laser treatments. By the way, let me just see. Okay, so, hi, Erin. She says, hi, April. I'm here. Thanks, April. And this is a touch screen, so don't mind me. I'll be scrolling to see your questions. And I'm also going to pull it up on my phone here, because sometimes I don't get to see them all. I want to make sure I see us popped up on here. And let's see. Usually it's popped up. Where am I? Where are we? All right, anyways, let me see. Scott's on. Hi, Scott. So Leanne Grego. Hi, Leanne from San Diego. Hi, Scott. Jamie, Lynn, hi. So listen, we want to know what you need from VBF. We network you to the best doctors we can think of that are in your close proximity. We created that What is a Vascular Birthmark card. All of you families and parents that are on there, I see there's 13 people on. If there's anything that you need that will help you better get your insurance approved, your treatments, finding the doctor that you need, family support, we're exploding with our Global Ambassador Program. We're going to be taking a new change with it, breaking it down into young adults. Hi, Brenda and Jamie Lynn. So, this is your time for you to ask us. We're only on for an hour today, and Kristin and I will be making physical and mental notes of everything that you need from us. We have our conference in New York next year, and it's in Irvine, California this year. We just got back from Greece from our I-Team meeting. We're in negotiations right now for China. We're in discussions with Serbia and Jerusalem. So those are some of our international trips we're talking about. Aaron Wilkerson's back on. Hi, Aaron. So let us have your questions. I mean, I'm excited to see people joining in. We have 11 right now. And what do you need from us? What can we do for you? What do we have coming down the pike? At the conference this year, we have a cloves expert. For those of you who don't know, cloves is really now an umbrella term for overgrowth syndrome. So the enlarged arms, leg, truncal area, people with clipotrenane or even lymphatic malformations where there's an overgrowth of the limb or even in the trunk area. So that's now under a new umbrella called cloves. So we have an expert. Our first question from Jamie Lynn. Thank you, Jamie. I would love to have some cards about what is vascular birthmark. My daughter would enjoy having something like that to better explain. So Jamie Lynn, we created that. It's a PDF and it's also a JPEG. You can print it at home, but maybe we should get a volume of them printed up in different sizes, like small and different. So let's make a note of that. Well, what we'll do is we have the file that we can send you, Jamie Lynn, but what we're talking about is actually printing some up and then sending them out for free to people who want them. So maybe we can make them like 5 by 7 or a 4.5 by 5.5, which is a standard greeting card size for parents to give to their kids too. And on that card that we have, Jamie Lynn, it has a lot of examples. Hi, Mahela. She's joining us from Eastern Europe. So she's one of our families. Joey Kretzinger, my medical aide is requesting radiology, ultrasound, and histology results in order to approve my daughter's next treatment. How do I answer them? Also stating that it is a cosmetic treatment. Number one, it is not cosmetic. That word should never be used. It's restorative. It's restorative treatment, restorative surgery. You restore it to what it would look like without the vascular anomaly or the vascular birthmark. So I can put you in touch with Dr. Hasso. He is our expert radiologist, and he can come up with some wording for you. So just email me, Jody, a little bit of information that you might need from us at vbfpresident@gmail.com, because he can actually write a letter as one of the VBF experts on your behalf. One of our doctors can do that for you and just say why the imaging is needed, because it needs to differentiate what it is, and then the treatment is not cosmetic. We can absolutely help you with that. Okay, Heather just joined us. Oh, we're from South Africa. Okay, that doesn't matter. It's still, imaging is still needed. 1, to diagnose a vascular anomaly. 2, so the doctors will know how to begin treatment. And Dr. Hassel can tell you what the options are. And if you want, he could even communicate with the physicians in South Africa. Our experts are great. Hello from Croatia. So she follows us wherever we go. We don't know where we're going to be next year yet, Mahela. So, but Dr. Weiner does now have, he's starting a clinic in Jerusalem, and so he will be having a laser in Jerusalem too. So that's now an option for our families in Europe and the Middle East, is to go to Dr. Weiner's new clinic that's going to be in Jerusalem. So let's see, Jamie Lynn, that is exactly what I just went through with approving my daughter's treatment. It took a month to be approved from her laser. They were saying it was cosmetic. Yeah, it's not. We have medical journals that say it is not cosmetic, it is not elective, but that's the verbiage that's used under the Affordable Care Act, where insurance companies can deny a treatment if they deny it to you and say it's cosmetic, elective, or not a medical necessity, then that kind of gets them off the hook. Then we got to write back and say that's a lie, because it is not cosmetic, it is not elective. These are progressive lesions. If they're hemangiomas, they can be destructive, problematic, disfiguring. So we have the verbiage. We've been working with the American Academy of Pediatrics. We got a letter signed by 5 presidents that we send out that says this is not cosmetic. Aaron, hi Aaron, I know you guys have a letter for insurance. Yes. Do you also have one for EEGs or MRIs, MRAs? We don't, because we've never had to have one, Aaron Eskadilson, but it's something we could get if you want. I could ask Dr. Hasso to draft a type of a routine letter that says what is the purpose of imaging used in diagnosis and treatment of vascular anomalies. Then we can make that sample letter available for anyone who needs it. So see, Aaron, you just gave us a good idea. Thank you for that. So we will work on it. And by the way, email me back in like a month, Aaron, and that letter will be ready. Brenda Marina Camarina said her question is, do you recommend a repeat later in life for Sturge-Weber if it was clear? So according to Dr. Ann Comey, who is our Sturge-Weber expert, if you have 2 MRIs prior to the age of 5 and both are clear, then she says 99% chance there'll be no Sturge-Weber. That's her guideline and her rule. If you had one when they were young and it was clear and now they're an adult and they haven't had a second one, you could have the second one. You can also email her through our website. She likes the rule of 2. She likes one done within like the first year or 2, and then she likes another one done sometime after that, maybe before 5, and then that way you kind of get that burden off your shoulder of having to worry about it. But you can also email her. I don't know why your insurance denied the EEG, but again, Aaron, we can help you with that. We can get Dr. Hasso to write a letter, even if it is a different country, and say, we here in the United States use these for diagnosing vascular birthmarks, anomalies, and related syndromes, and they're absolutely essential. Okay, so let's see, that's it. So we have 15 of you on right now. Again, our conference is in October 12th, Saturday in Irvine. Dr. Stuart Nelson and Dr. Martin Mim are our medical directors. We have experts from all over the world that'll be coming. Okay, oh, Erin, right, you're from Illinois. Okay, Roxanne is on right now. Will there be a nutritionist at the conference? If so, is it possible to have an appointment with them? No, we do not have a nutritionist, but I can tell you this, that Dr. Comey does believe people who have Sturge-Weber should be on a specific diet because that diet can control seizures. And it's typically a high protein diet. And she has talked about this in the past. I don't know that we've ever had a nutritionist, but it's something we could look into.
Definitely.
Especially because we do have the questions that come up primarily with the patients that have seizure disorder with diet, because that is the new thing. But even along what Roxanne's saying is we're getting a lot of inquiries too about the CBD oils.
Yes.
And Dr. Comey has told us that they're using those with patients with Sturge-Weber. They're starting to get into the CBD oils. So that's another thing she'll be talking about at our conference, and maybe we should even get a fact sheet on that, since it's a hot topic of CBD oils used in the treatment of vascular anomalies. So thank you, Roxanne, for that question. Okay, so again, what else do we have? What are the other things we have to offer?
Well, right now we are working on a lot. I hope that everybody has seen a little bit of changes on our website. We've been working really hard to update the information there, which I'm sure all of you know. The literature in this field is constantly changing, especially in the last couple of years with all of the advancements that have been made, and there's new research and discoveries constantly being made. So we had Sarah Kennis, who is an RN and is working on her PhD right now, providing us with substantive updates to our website. So if you go on there, you're going to see all types of updates. Right now, we just updated our medical resources page. So it has a whole list of current medical resources, including a list of current research trials and studies that you may be interested in participating in.
And she's also a board member.
Yes.
And has a vascular malformation.
Yes.
So we got a lot from Sarah, because she's an expert now in this field. She works in a hospital. She has a vascular malformation, and she's on our board.
And there's nobody better who we could rely on to provide those updates, because she also does it from the perspective of the patients.
And she's using this for her doctoral study.
Yes. So. And she's also working, so maybe towards the end of the year, you should expect an update of our birthmark types information on our website as well, which Sarah is working hard on. So we're really excited to provide those updates to you all. And please let us know if there's any more information you'd like on our website, if you're having trouble finding anything. We really love that feedback, so we know what changes need to be made and what kind of priority as well.
Gives you free lodging. We're working hard on, so we're really excited to
the delay in us talking.
Yeah. So we really do want to have your feedback. I know sometimes you're not quite sure how to provide that, so you can always email me at info@birthmark.org, reach out to Dr. Linda. Any of the email addresses on our website will get to us, and we really do want to hear it back from you so that we can make sure that we're giving you guys everything that you need. So never hesitate.
Yeah, some of the things that happen, that's why I keep my phone nearby, because they're not appearing here. So Leanne Grego said, will he email info to me for a military IR? We also have a military expert, Dr. Thompson, that we can work with. So absolutely, we work with TRICARE. We have a lot of information. Don't worry about that. We have resources. Kristin Sullivan said she wanted to say hello. Her 18-month-old just got done with treatment under GA. We'll watch later when we are home, okay? Leanne said we move, and they move a lot due to military. We know that. The main thing is TRICARE, and to find you resources within our network that accept TRICARE. But I work with these doctors all the time and ask them to make exceptions. We have a family in Texas that one of our doctors normally doesn't take TRICARE. So what I worked with him on is a flat fee that would actually be less than her insurance. So if she would have to pay $400, I'll work with the doctor to try to discount the rate to what it would be, and she pays out of pocket, but at least he doesn't have to worry about not applying the TRICARE.
Yeah.
So there's a lot of things that we can work with.
And even on the grander level, in terms of legislation, we're a nonprofit, so there are some restrictions in terms of how much we can engage in that level. But we're also thinking about working on changing some definitions, maybe at the federal or state levels, to try to make sure that vascular birthmarks are never in these undesirable categories, like cosmetic. And I think that would, transcend the literature there.
Right. So Leanne, again, I know you said you need the info. Just let us know, like email me directly, and I will put you in touch with our doctors who can write on your behalf. Roxanne wants to know, will there be any discussions on compression modalities? I have KTS, which is Klippel-Trenaunay syndrome. So Dr. Delphinian discusses the importance of compression at our conference every year. I've really been trying for years, and if anybody knows of any compression companies that would be willing to come to the conference and have a demo session for us and bring some samples, I've been trying to get that done for years. Eric Pixley's on. Hi, Eric.
Yeah, so if you guys have any of those connections to companies that you use for compression garments, shoot them our way, and we can definitely reach out to them in hopes that we can share that info.
Yep. So see, like it's saying 31 comments, but it stopped here. It just does this. It just locks up, and I don't know why it does that, but it's all right because they'll show up on here. Like it just said Eric is on. So, okay. So again, let us know. We're taking notes. You were also talking about the Find a Doctor, so the improvements we've made in that.
Yeah, so we have a Find a Doctor directory on our website, as well as an Ask the Experts directory. The experts, you have a little bit more information. You can email those directly. Those are people who have been with VBF for a very long time, and we really have seen them transform lives through these surgeries. We know their specialties, and the Find a Doctor directory is open to all physicians. So we really encourage you, if you have a physician who has served you well, please have them either reach out to us or let us know about them, and we'll reach out to them, because we want to make sure that directory is complete with the really best people.
And what email should they write to you? Or
you can write to me at info@birthmark.org, just because it's easiest. I'm also at Kristin@birthmark.org. It's me and Linda and Lauren in terms of actual employees, and we have some other really important people on our team who are contractors. So we'll get it somehow if you send it to one of them.
So we have a couple more questions. Leah Carter Bennett says her 8-year-old daughter had a very large reish on her leg. It involuted, but still very obvious, and she has a large vein. I see that a lot with these reishes. We are pursuing treatment because she loves her boo-boo knee and it doesn't bother her. I don't know what your question is, but we can have one of our doctors take a look at it. But these reishes, if they're not removed, they'll just be there forever. Now, I do want to give you one caution, Leah, because it is a reish and it hasn't been removed, it can act up. So it would be important for you to talk to one of our reach experts, only because she's 8 years old. In 2 or 3 years, when she goes into puberty, we see some of these change. In other words, it can re-stimulate if it's not removed. So I'm just saying, as a caution, if you want to talk to one of our doctors, he can explain to you why you might want to have that looked at and possibly treated, if it's possible, because they leave so much redundant tissue when they shrink, and they often will remove that redundant tissue. But the fact is, if it's never treated, there's some question of whether they can reactivate themselves in puberty. Hi, Kalpana. Kalpana Sharma is watching, and she's one of the first people VBF networked into treatment back in like 95. And she's now an inspirational and motivational speaker. So we just love Kalpana. Okay, so Lee said, yeah, interesting. Okay, so yes, please. Okay, so again, email me directly or Kristin, and we're going to be going through all of these on here to make sure we haven't missed any of your comments or your concerns. We've got the information on the card, and maybe we get 1,000 or some of them printed up, small ones, and we make them, people can just sign into us and write into us, and we can send out, 5 or so of them at a time. I think we should also send them to some of the doctor's offices to
Yeah.
pass out the little information card we have, what is a vascular birthmark. And by the way, parents and anyone listening, you know, we get a lot of inquiries about parents that are being stopped at the airport, stopped on the street. One of our moms had a knock on her door in the middle of the night just last month, and Child Protection Service was called because they thought she was abusing her child, and her child just had laser, and you get the dots, the purpura from the laser, and someone thought she had hurt her child, and she was so upset over this. And that's why I'm like, we want you to carry this. We give you it as a JPEG too, so you can carry it on your iPhone and show anybody, and they can read what it means to have a vascular birthmark and see the pictures with the purpura. So what else do you want to talk
I wanted
about?
to mention about the Find a Doctor directory. This is now a searchable directory. So if you leave the search parameters really broad, you can find kind of any experts by location, but it's a little bit more integrated that way. So you could search by birthmark type, you could search by your location. So that's something that's been updated, and we hope that you'll find useful so that you can really get to the specialists in your area who treat things, the birthmarks like yours. And that's similar to the Global Ambassador Directory, which we have on the website now. You can now search to reach out to global ambassadors near you by birthmark type and as well as by location. So yeah, check those out to see if you can either reach out to a global ambassador or find a doctor through those, and definitely keep us posted if you encounter any issues so we can keep improving those services.
So Tara Garrett still in Jax with no available doctor. What do you mean by Jax? You mean Jacksonville, Florida? What's JAX?
Mississippi?
I don't know. Let me know. Tara, what do you mean Jax with no available doctor? Mayo refused to see me, denied. SCA. I'm not sure. Are you talking about California? Southern California? I mean, just where are you, Tara Garrett? Like what city, state? Oh, Florida. Oh my gosh, I have so many people in Florida. You might have to travel a little, but just email me, Tara. I mean, I'll get you in. There's no question. I have 3 experts in Florida that I deal with all the time. And are we talking about a Port Weinstein? Is that what you're? Yeah, I think laser treatment is what you want. If that's what you want, Tara, email me at vbfpresident@gmail.com. Include a picture of the birthmark. I don't know Florida geography well, but I can tell you I have 3 experts in Florida that treat these and will not do a denial. You might have to go to Nicholas Children's Hospital, but yes. Oh, plus KTS, yeah. And now we have a team out of Orlando that has a great interventional radiologist there, that Dr. Johnson, that we can also refer you to. So these are the things we need to know, is what you're having problems with.
We also have the KTS, the Weber Memorial Fund, which provides funding for those with KTS or exploring whether or not they have KTS to fly to seek a specialist. So maybe Dr. Linda was saying if there was a specialist local, that would be the first stop, but that's also something to look into for our website. I think it's up to $1,000 per applicant for travel to see the KTS specialist. And that could also be used for anybody else listening to come to our conference.
If they have KTS.
If they have KTS.
So CHOP is Dr. Treats, TREATS. Look him up. Otherwise, you can just take a metro or whatever into New York City and definitely see Dr. Bly. She's a niche reach expert. But you can also see Dr. Treats. I think he's pretty good. Amber, would it be possible to coordinate a meet and greet at the Hospital Irvine for Friday night before the conference? We can, that's actually a good idea, Amber. So maybe what we'll do is we'll have Scott work on that as our head of our Global Ambassador Program. Now we're going to be doing our board meeting, but he won't be at that. I don't know. I'm not sure. Maybe not.
Yeah, maybe. Well, I think it's useful enough that hope we can make it.
There's Amber. We're gonna look into that because I'm actually going out to California in 2 weeks to review it. There's a real nice open area at the hotel we're going to be at, and we could set up some coffee and cookies and stuff maybe for people, and then make it an open thing from maybe 6 to 9 for families that get there, that you can informally meet with each other and discuss it. And, you know, we can have one, Scott could be on hand to be the person that kind of facilitates for VBF. And if Leslie's there, we could ask her. I'm not sure when she'll get in.
I think that would be great too, so that you can kind of meet each other maybe on Friday and then Saturday, and if you're staying a little later, maybe you can get together.
Well,
and,
yeah, Amber,
know,
we can't be that specific on Friday night. What we do offer, Amber, is psychotherapy sessions that are broken down during the conference on Saturday. But we can't, we'd have to pay, and right now our contract's all done. But what I'm saying is there is a kind of an open area at the hotel where people sit around on giant couches and chairs, and we could just make that available, tell everybody that our global ambassador will be there, and if families want to meet, or adults or whoever, that it's an opportunity, and we'll just put some cookies, coffee, juice out for the kids there, just to try to make it like a little reception area. And, you know, even maybe some of our doctors that are in town will go down and say hello. But it's a nice idea, Amber, and I'm glad you suggested it. Thank you. So you can be our point person. So email me or Kristin, Amber, and we'll make sure when we do our, yeah, but the problem is, Amber, we're in New York City, opposite years, and there's logistically nowhere to do it. And this is our first time at this hotel, so it's kind of a trial run for us as to what we have. But I love it, and I do think we can use this open area that they have for you to just informally meet without us like literally having to pay for it, but just kind of make it informal.
And then maybe it's something we can explore expanding in future years.
Right, for California,
Yeah.
for New York, it's going to be hard because we don't have access to the hospital on Friday.
Yeah.
We only have access on Saturday, the day of the conference. But we can
But there's
make,
also like cool places in New York to meet up regardless,
Right.
you know, parks and.
but we also have like the hearth room that we could make available throughout the conference in New York, and just let people informally go in and meet each other. Yeah, well, we'll work on that. We'll
Yeah.
work on that. Hi, Andrea. Andrea's watching now. Andrea
And
Costello.
Amber, if you have any specific suggestions or examples, definitely shoot them our way by email. I recognize your name. So.
Yes. Okay, so it says we have 55 comments. I just want to make sure we're not missing any. Okay, got a lot from Amber. Tara said thank you. That's about the meet and greet. And Leah. So again, Leah, check with Dr. Treat, Treat at CHOP. He's an expert, and I'm assuming he'll be an expert in niches and reaches, because I know he's done a lot of complex cases. If you have any trouble, just email me, and you know I can give you Dr. Bly's email, and you can just communicate directly with her via email or go into the city to see her. But she's an expert on the various vascular anomalies that are labeled as niche, non-involuting congenital hemangioma, the reach, the rapidly involuting, the PEACH, the partially involuting. And that's what you really need, is somebody that really understands the differences in those. So again, we are almost a half hour into our Facebook Live session, which we will be doing once a year, where we will be asking, Kristin and I will be asking all of you what you would like to see at our conferences, on our website, in our social media, on our Facebook page, with our experts. We've been doing a lot of surveys. We have one of our board members, Elizabeth Dishman, has been very active in helping us create surveys for families to assess what you need. I reported on these surveys in Greece. 50% of you wanted your children to have anesthesia for laser, and 50% didn't. We didn't know this until we did the survey, so it's important for us to do this. Katie just signed in. Hi, Katie Branham. Just wanted to thank you for all you do. You and VBF made such a difference in our life over the last year. Thank you very much. Steve Mears is watching. By the way, anyone listening, Kristin and I were talking about this morning. If you've had any surgeries through VBF or treatments, and you have a before picture that shows the vascular birthmark, and then current picture that shows it gone, if you could take a picture of that and let us use it, we'd like to start showing a child holding an actual picture of what their birthmark looked like, and then you can see them in the same picture. So you see the before and after, but you see the child. So if any of you have that, please send it to us. We're going to post it out on social media that we need that. Hi, Steve Mears. A lot of these names are sounding familiar to us, a lot of our families over the years. So we have 56 comments. We have 11 people on. Oops, again.
I can say another thing that we have been working on are updates to our chapter sites. So if we've launched so far VBF Greece, VBF Europe, and VBF Italy. We're almost to the point of launching a Sturge Weber community site, which has been updated, and Dr. Comey is going to be featured as our expert on that. And we've also working on chapter sites in the Philippines and South America and some other countries as well. So if you're located in any of these areas, if you think that your locality needs a chapter site of its own, if you're interested in volunteering to help with those chapter sites, how we're doing it is we're having one global ambassador manager be a point of contact on each of those chapter sites, so that when you reach out to VBF Philippines, you will be speaking to someone local in the Philippines who can guide you to local resources, as well as a local vascular birthmarks expert in those areas. So if you have any interest in being involved in that, please shoot us an email and let us know, and just expect those to be coming down the pike maybe by the end of the year, to have those offerings locally and international level.
Yeah, and our global ambassador is exploding. Like Scott Couples is our director, and we have right now on our website about 115 profiles of our ambassadors from around the world. And these are adults with a birthmark, parents of children with a birthmark, young people with vascular birthmarks. And we're going to start having more charges and more things for them to be doing. Maybe meeting up with people in your various countries who are going there for surgeries, getting the word out from us on psychotherapy issues facing families. We want to put something together for people that have a visible vascular birthmark that go on job interviews, because a lot of them have written to me saying they feel that it impacts them on a job interview. And we want to work with Leslie Graff, our child life development specialist, who will also give some helpful tips for families. So there's so many things that we can be doing. And again, today is the opportunity for you to tell us what you would like, what you need, what we could do to improve, what we offer for you. The world has changed even since I started it 25 years ago. The website birthmark.org in 1997, when it launched, was all data. And then I added a few pictures, because then they started allowing you. But if you first looked at it, it was like typed words on white paper. Then we started being able to add color images and color background. So we've really come a long ways. And but the trend now more is to social media.
Yes.
So we're making a move that way more. We have our Instagram, our Twitter. We're looking to expand the work we do through social media. Any suggestions that any of you have for that as well, we're very happy to take your suggestions and ideas. We're going to be looking next year to expanding our team, and maybe looking at more, not just fundraising, but marketing, branding VBF all over the world more. We know, because you just Google what is the #1 vascular birthmarks foundation in the world, and it pops up with VBF. So if it's good enough for Google, it's good enough for us.
But I think why VBF has become so successful, despite don't have a lot of resources, is because of social media. And we're at an interesting point with patient advocacy groups now, historically, where maybe when you started VBF 25 years ago, it was a whole new thing.
Right.
And
very
now,
few people had computers.
Nobody even a patient advocacy organization was a totally different thing. And now with social media, our reach is something that doctors look for us too, and we can really make sure that the patients are involved in every single step, from when the medications are being developed, to research trials, so that you really get in at every single step, so that it's not you're not receiving it at the very end. And I think it's a very important time for patient advocacy groups that our value is really being seen on a global scale. I think because of social media and the success that we've had there. But Yeah, know that we're here to make sure that you're involved, not just in the afterwards in the treatment, but we really want to make sure that your opinions are in every single stage of this. That should be number one.
And again, you know, we have our conference every year. We alternate between New York City and California, and most of our patients come for free. We ask for $100 reg fee if you can afford it. If you don't, you don't even pay it. So we don't do it for money. We use our corporate sponsors to help fund the conference. We've been very fortunate to have that done every year. We give breakfast and lunch to the families. You participate and go into all of the talks given by the experts like Dr. Wayner and Dr. Nelson and Dr. Coletti and Dr. Bly, Dr. Rosen, the top experts in the world in all the various fields of every vascular, birthmark, anomaly, and syndrome type. That's why we're excited this year to add a few new people. Dr. Pappas is coming, our geneticist, because a lot of families have questions on genetics. Okay, so Sonal Mangani has written in, my son has a veno-lymphatic vascular malformation. I see less doctors from India associated with it, searching for the right team. Well, you know, actually, Sonal, we went there in 2012 or 13. We went to India and we did a full VBF I-Team conference. We were in Delhi at Medanta Medicity Hospital. I was very disappointed that they did not even attempt to keep that program going. I kind of feel like we may end up going back to India to another area. We are looking, and if anyone knows of any doctors in India that treat these, we need to add them to our list because it is a desperate need there. And I understand exactly what you're saying. But I can tell you, Sonal, that I can have you at least talk to my doctors in Greece and Italy, and sometimes if you talk to them, they may find someone they know in India. Like Dr. Rosen knows an interventional radiologist in India, and if your son's veno-lymphatic malformation is on an extremity, he may be someone that can help. So you can, you know, email me and I'll see, like, even if maybe Dr. Rosen can give me a name for you. Aaron Eskildilson said, do you think you will ever do the conferences in other states? Well, the problem is we have to go where the funding is. It's about $50,000 for a conference, and we can only do them where we get them completely funded. I mean, like Kristin said, we're only 2 full-time people and 3 or 4 part-timers, and I wish somebody would just come along and give us, you know, a couple $1 million, and then we could have 2 or 3 conferences a year in different states and different countries. Unfortunately, we can't, but we do a pretty great job every year with our conference, and we end up with about 300 people. So
that is the unfortunate reality of a nonprofit, is we just rely on donation. It allows us really to have the impartiality that goes along with that, but it's just the
right. And you know, we do at least have them in international hubs for flying. A woman wrote to me yesterday from Belgium who wants to come just to get the free laser because she can't get laser for her child. So they want to come from Belgium to California to get a laser with Dr. Nelson, and I'm trying to work on that right now. The same with when we're in New York, we've had people from China, India, Egypt, Poland, Croatia, just all over the world, all over. Hi, Jody. Jody Lee saying hi to me and Kristin. Great to see you. And thank you. Yes, April is our social media director, and she's saying that it's thanking us and that, you know, we are bringing attention to the social media. The social media is very important to us. Like even for me sharing this Facebook Live, I post to 59 different groups that have vascular birthmarks. And our next session, by the way, next month, I believe it's August 2nd, but we'll post about it next week, is with Dr. Nelson, and he is a world-renowned laser expert for the treatment of port wine and other vascular lesions. And he's actually going to be talking about a very big, hot research project that's coming up with port wine stains, which is going to be looking at when to stage the treatments for maximization. So what results do you get under 1? What results will you get under 2? What results will you get under age 3? And that's going to be important for the families for making the decisions on, can we delay treatment? Do we need to do it now? So I'm very excited about what that study will yield, and we will be working with him on getting the patients to participate. And that's another thing with the surveys that Elizabeth is working on with us. We rely on all of the 59 groups we post, and when I did my small survey on, did they prefer anesthesia or not, all the people responded from all of those groups. We got good information in a real short period of time. Elizabeth Kastiamisi, sorry, I'm probably really doing a terrible job on your name. My son has lymphatic malformation in the neck and face. Thanks for you doing these lives and bringing more awareness and spreading knowledge. Thank you, Elizabeth, and I apologize for having a hard time saying it. I'm pretty good usually, but that's a very interesting last name. Kastiamisi, maybe? Not sure. But thank you. So let us know, we have 20 minutes left, what kind of resources we have. Almost everybody on our board has been affected by vascular birthmark, anomaly, or syndrome. We have firsthand experience from families that have been through this that can chat with you. We have adults living with a vascular birthmark. One of our long-term friends, Kiana Smith, lives in Trinidad, and she's been in the public a lot, newspaper stories, national programs about her life and living with her vascular birthmark. She's undergoing treatments right now. She's been getting treatment, and she's another one that can share personal experiences with people. And that's very important because a lot of the families write to us and say, I want to talk to somebody who's dealing with this. How do I talk to the brother that doesn't have the birthmark? What do I do when we're out in public? And that's one of the reasons we created the card, What's a Vascular Birthmark? Because a lot of families told me they get angry, and I was one of those families. I was one of the ones that was, said to me, what is that on your child? Did you hit her? So I've heard it all. This card is kind of like a mindful awareness way of telling people this is what it is. It's a vascular birthmark. They occur in 1 in 10 children, and the purpura is from having treatment, and nobody hurt the child. It's not contagious. Don't worry about your child catching it, which I get all the time. So that card is very important, and I think it's worthwhile for us to get it printed, and it may end up even getting printed in different languages for anyone who wants to translate it for us. Okay, so you said, I mailed you with all the details, help me in getting the right opinion. You've met with many surgeons. We'll definitely update you on the search in India. Thank you, Sanal. We have a couple people from India, like Batul, who is very interested in getting something going in India. So I can also introduce you, Sanal, to Batul, because she's very interested in trying to get VBF India to have more doctors participating in creating a more supportive network. I mean, India is a big country, 1 billion people, huge geographical difference from North India. You're going to be down in Goa or Hyderabad, and then all the way up to Delhi, and then all the way north. We understand, like here, people have such easy access to transportation, but we understand that that's not available in India. And I know I saw it firsthand when I was there. So again, we have 15 minutes. So what else, Kristin, would you like to?
Well, I wanted to mention, even since I came on to VBF, there are so many people who have contributed to VBF in the last 20 years. Some of the names that you brought up, so many of our board members like Sherry and now Corinne, Scott Couples with what he's done with the Global Ambassador Program, April with how she's helped with our social media.
And let's talk about the Purple Polka Dot Race.
Yeah, Jody and what she's done with the Purple Polka Dot Race.
I would love one of those in every state. That's like an amazing 5K race to raise awareness about birthmarks money, brings people together with birthmarks. I'm looking forward to going in a couple weeks, and families with birthmarks come just to meet with experts too. And imagine if we had a Purple Polka Dot race in every state, like the Susan G. Komen has the breast cancer run in every state. I would love other people to do a race which would raise awareness.
Yeah.
And the purple polka dots is for the purpura that you see on the face after laser. And she's really created that.
But
whole
it's
thing.
amazing to see that Magadana was born with port wine stain,
Yes.
and to see this family really not only rally around her, but also rally and create a whole community, not even just where they are located in Michigan, but now it's really a national event. So, you know, it's just it's so awe-inspiring and positive to see so many people throughout VBF's history who have given of themselves and time and money to really make this difference in a field, just from my perspective. And a thank you to you and everybody watching and everyone who has been a part of this from the beginning.
So Leanne has a question. I have a port wine stain on my back, top left shoulder area. Growing up, people always ask me if I was hit. And we hear that all the time. And by the way, Leanne, I don't know if you've ever had it treated. The old lasers did not have a very good result. Dr. Nelson and Dr. Geronimus are getting some clearance on the extremities. So don't think that treatment is no longer an option for you. It can be an option. You can always get a test spot done. Next year in New York, you know, Dr. Geronimus does 40 or more free laser treatments. So we get the most people that come to New York for the free laser with Dr. Geronimus and his team. And this year, and we're budging up to that in California because there's different restrictions. But there's a lot that we can hopefully offer as we continue to grow with California and them getting more used to the free laser treatments. And I'd love, again, to have a compression garment workshop. I'd love to have a wound care specialist. And now that FAVA is getting out there, which is the fibroadipose vascular anomaly condition, where a lot of these patients have severe pain, to get more of an expert on pain management in vascular anomalies to start coming to our conference. Because I think that's going to be important for people to have that option. So let me just say, I want to make sure we're not missing any questions. So Jody, yep, she said hi. Sonal, Lee, okay, no treatment, I see.
The other thing I wanted to mention is if there are any ways that you would be interested in volunteering with VBF in any capacity, whether it's as a global ambassador or whether you have a specific skill set where you see that you can contribute, we're always open to any of that feedback and anything that you can become involved with to help what we do. Because as you know, we're just a couple of people over here trying to help, but we recognize that you all have expertise and also have the input that we might not be seeing. So we really are always looking for that.
Yeah,
input.
we call VBF a family, you know, and it's a network of the physicians that are the experts, the families that are affected, and then our team, our board, and all of us members of VBF that bring you all together with the doctors and the experts and the services that you need. I always call us the conduit. We are the conduit between the family that's affected and the doctor that treats. And we're an important conduit because the doctors don't know how to find the families, and the families often don't know how to find the doctors. That's why we exist. Let me just see. I think we're caught up here. 66 comments. Oh, and April posted a link to the Purple Polka Dot race, which is coming up. Any of you living in the Detroit area, if you'd like to come, there's still time to register and come. I will be there with Jody Lee and her family, and a number of families that have vascular anomalies come there. So yeah, we do have a doctor in the Philippines, Dr. Reiner Cirillo, and he is in Manila. He is, would love to try to get a conference in the Midwest. I'll answer that. So Dr. Cirillo is at, I have his email if you want to write to me, but it's Reiner_C@yahoo.com, but I can also give that to you directly. We are also trying to get the VBF mobile education program. They did write to me recently about bringing that to the Philippines to educate more doctors there. So hopefully that will happen. Yeah, we did talk about this. Jody wanted to know about conferences in other states. Right now, because we're funded in New York and in California, that's where we go. And it's about $50,000 to have a conference. And that's why we don't do it in other states, because we have the funding and the facility. And I mean, even that having it like at the Lenox Hill Hospital saves like $20,000. So it's really about, we're a small organization, and you know, I'd gladly go to another state, but someone would have to really come through to financially sponsor that for us. It's a lot, because remember, we do free hotels, the meals for the family. We have the clinic, which we see often 125 to 150 patients are seen by experts in our clinic. The psychotherapy groups are very, very popular. We have free makeup sessions for people with a birthmark that have never seen what they would look like without it. Professional makeup artists that come and do the makeup. And we do have insurance reps that will meet with you and discuss some of the problems you have with insurance. Yes, Jody. Yes, Jody. We need 50K to hold conference. Yep, that's what we need. That's minimum, depending on where we have it. There's been talk. You know, people have asked to bring it to Texas. Dr. Duarte wants it brought to Miami, but there were restrictions. What we do in New York and California that's very important is we bring doctors from all over the world. This year we have a doctor from Greece and Italy, and then all of our US representatives will be there. We can't be restricted and have it in a state where they only allow the doctors from that state to be there. But some states, some places have that policy because they want to keep the patients in their state. So in New York, we don't have any limitations. We can invite doctors from all over the world. And it's the same with California. Hi, Jackie. Jackie Keating's on. Hi. Good to see you with keeping up with all my babies. This live had, oh, thank you. Leanne has said this has been very informative and is thanking us. Jackie, you would be another one, Keating, that I would like to have a picture of you holding your Maddie's picture of her hemangioma and then her now, because that's what we're trying to show people, like how cute and happy she is now, and then with the hemangioma, and show that dramatic transformation. So that'd be something, if you could send that to me, Jackie, would be great. And I think that Maddie would be happy to do that for us. So let's see, we have 8 more minutes. And I want to make sure, it says we have 73 comments and I'm not missing any. So there's Jackie, she's our last one. Yep, we're doing pretty good, Jackie. She's also spoke, and she was the one when Dr. O got the Physician of the Year.
Oh,
she
yes.
spoke about how the vascular birthmark impacted the family. Thank you, Jackie. She'll mail it to me. Oh, and she's another mom, you know, and I'm sure she'll talk to any moms that want about the serious impact. She has twins, and it was severely traumatic for her because this lesion was this big on her child's chest, and it was ulcerated. And the other twin had nothing. So, of course, every day the mom's dealing with the baby in pain, and doctors giving her all kinds of crazy information. And then the impact it had on her marriage, the other child, and could, you know, parents have told me they can't even work. They can't even have a job because they have to stay home and take care of their child with the vascular birthmark. So she knows, she's been through this, and she has a third little girl now, and everybody's doing great. And I follow her on Facebook just because I love seeing
all of your birthmark.
Yeah,
babies.
I love to see all my babies. And she knows that. I always tell her, say when she posts her pictures, I'm like, my babies.
But that's what you always say, is this isn't a vascular birthmark on this one person. It's a family.
Yes.
This is going to affect every single person in the family.
Yep.
Which you will.
Oh, Lori, she's been trying to email me with pics of my daughter's VM. But it cannot insert pics. That's weird. Okay, so do this, Lori. Just email me in the subject line, put VM daughter, but don't add the pictures. Let me respond to you. Then when you write back to me, attach the picture. Okay, do it that way so we establish a communication, because Gmail can be funky sometimes. So Lori, just send me an email that says daughter's VM in the subject and say, saw you on Facebook Live. Give me a little history. Was it present at birth? Has she had any treatment? And then I'll write back and say received. And then you can send me the picture on the reply back. Yeah, Jackie quit her $18,000 a year job because of Madeline's hemangioma. Yep.
Yeah, and that's only cosmetic, right?
Yeah, right,
No,
right, exactly. No, we know better than that.
No.
She heard me on the phone last week, right, when a
Yes.
mom called saying that the doctor really yelled at her and kicked her out of the office because her daughter's hemangioma was nothing. And I'm like, are you kidding me? These babies do not have to go around with these massive lesions on them. And it never made sense to me 25 years ago or today that they can take the heart out of a human and put it in another human, and then they send parents home with these babies with these giant hemangiomas and port wine stains and say, oh, go home, it's no big deal, it's just a hemangioma or port wine. That's absolutely ridiculous.
Yeah.
Every parent has a right to have proper treatment for their child. Every child has a right to not have to be bullied, and that's why we exist. And that's our fight, and we're happy to take the fight. We're happy.
Yes.
So we are 5 minutes left to go. Yeah, Jackie. Yep. So right. She was saying no one had any clue of what to do. And Jackie, I mean, Jackie they don't live in like, the mountains of Kentucky where, there's no Wi-Fi. They're in a metropolitan area. People from New York and New Jersey and Pennsylvania are saying, oh, my doctor doesn't know what to do about this. And this is why I keep working with the American Academy of Pediatrics to keep educating.
It's not even like they're saying we don't know what to do, so here, go visit this other person who does know.
Right.
Like the woman you spoke to last week was literally made to feel that she was imagining that her daughter had
Right.
something and was kicked out of the
Yeah,
doctor's
they were
office.
like, oh,
imagine.
get out of here. There's nothing wrong with your child. And her daughter didn't even want to go in public, didn't want to wear a bathing suit, had low self-esteem, and they're saying, go home. I'm like, are you kidding? And now they're coming to our conference in California so she can meet with experts and get proper treatment. That's why we exist.
Exactly.
Right? Yeah, Pennsylvania. That's where Jackie lives. Northeast Pennsylvania. All these major medical schools there.
Oh,
And I mean,
goodness.
as a matter of fact, two of our board members, Marvin and Dinah, they're doctors. Their daughter had a hemangioma blocking her vision. It was this big on her eye. They went to 6 major hospitals in Pennsylvania, and all of them said, leave it alone. Yeah. And she was weeks away from going blind. And I sent them to Arkansas to Dr. Wayner. He removed it, and they've been on our board ever since, fighting the good fight, that we call it, fighting the good fight.
Unbelievable.
Yep, and Jackie was saying it was peeling layers off of, it was ulcerating and just peeling, and then they're just like, oh yeah, go home. Jessica, so if there is a poor outcome in surgery, you refer out to a specialist? Yes. If you've had, and that happens too, that's why we have experts who do this for a living. I had a young girl write to me last week and say, oh, I'm going for surgery on August 18th, but the doctor said he's really scared that I might bleed to death. And I'm like, cancel that appointment. And I put her in touch with one of our experts who does this for a living and has confidence. So if you're going to a specialist and they're like, I don't know what to do. Maybe we'll try this.
Wrong
no.
person.
Every parent deserves the best, the expert, the number one. Jody's like, all of these stories, yes, we would do Jody. That's why she does what she does. Christine, Dr. Linda and Kristin, I'm over 50 with a port wine on my face, had a lot of treatments when young. Nothing worked. It affected my siblings, kids, and adults are horrible. Doctor would ask me if my dad or mom hit me. I'm in Chicago. See, again, Dr. Mulligan out of Boston Children's says that these lesions have been misdiagnosed at the rate of 90% back in 90s. And today the misdiagnosis rate is still at 65, 70%. So we know that it's still an issue. Apologies for the phone ringing. That's okay. You want to go get it?
This is the VBF line,
yes,
by the way.
it is. It's our VBF toll-free line. So thank you, Kristin, for getting it. As a matter of fact, we're only 1 more minute to go. And by the way, the woman from Chicago, if you are looking for treatment, because we have a wonderful expert in Chicago, Kristin Wilms, if you'd like to go see our expert, Dr. Jerry Garden in Chicago, I can arrange for you to have a consultation with him. So in summary, thank you for this opportunity to hear what VBF can do for you. Was happy for all of you to get to see this beautiful face of our business operations director. So she can also hear from you what you would like as we begin to develop more programs for you. Oh, let me just answer this one question. So my whole life until I was 33, I was told the pain in my leg was all in my head. That's absolutely insane. And Heidi, you have a 11-week-old. Very important. Get me those pictures today if she's not in treatment. Because I know that you said she's 11 weeks old and it's on her lip. So it's very important for those to be treated, especially if the lip is a different tissue. So they don't, when they go away, they lighten, and you don't want to have pink lips with a white patch. So make sure you get to me, and also so that it doesn't like migrate away from the lip, like down here or something, and affect other tissue.
We also have an orthodontist attend our conference, so we have
a dental expert.
Yep.
So please email me with any issues or concern. Dr. Linda, PhD, the president and founder of the Vascular Birthmarks Foundation. My email is vbfpresident, all one word, @gmail.com. And you are?
I'm Kristin Delgado. I'm at info@birthmark.org. It's probably the easiest one to reach for me. And please definitely reach out to us with any questions and feedback, either now or in the future, and anytime. We really always want to hear from you.
And we will be going through all these comments and making sure that your suggestions are considered and hopefully all of them implemented. I look forward to seeing any of you that will be at the, okay, so Heidi said they started propranolol. That's fantastic, Heidi. You're right on top of things. Good job, Mom. Okay, thank you all. Take care. See you next month with Dr. Nelson.